The Centers for Medicare and Medicaid Services, CMS, recently released the proposed calendar year 2023 Physician Fee Schedule PFS rule. In one of the sections, the evaluation and management changes for 2023 were discussed. In this video, I provided you with the CMS proposed changes, but in this video, we will discuss the AMA details of evaluation and management changes. The AMA states, as part of the ongoing updates to E&M visits and related coding guidelines that are intended to reduce administrative burden, the AMA CPT editorial panel approved revised coding and updated guidelines for other E&M visits effective January 1st, 2023. Similar to the approach they finalized in the calendar year 2021 PFS Final Rule for Office Outpatient E&M Visit Coding and Documentation, they are proposing to adopt most of these changes in the coding and documentation for other E&M visits, which include hospital inpatient, hospital observation, emergency department, nursing facility, home or resident services, and cognitive impairment assessment. These are effective January 1st, 2023. So what has changed? Well, before I answer that, let me say, hey there, and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've served hundreds of students and helped them transform to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to smash the bell for notifications of my weekly videos. Or ring the bell, how about that? The CPT Evaluation and Management Code and Guideline changes are effective January 1, 2023. There are lots of E&M introductory guideline changes that are related to hospital inpatient and observation services, consultation codes, emergency department services, nursing facility services, and home or resident services. So here is a preview of specific deletions and revisions. Deletions of Hospital Observation Services E&M codes 99217 through 99220. Revision of Hospital Inpatient and Observation Care Services E&M codes 99221 through 23 and 99231 through 39 and guidelines. Deletions of consultations E&M codes 99241 and 99251. Revision of consultation E&M codes 99242 through 45 and 99252 through 55 and guidelines. Revisions of emergency department services E&M codes 99281 through 85 and guidelines. Deletion of nursing facility services E&M code 99318. Revision of nursing facility E&M codes 99304 through 99310 and 15 and 16 and guidelines. Deletion of domiciliary rest home, example, boarding home or custodial care services E&M codes 99324 through 99328, 99334 through 37, 99339 and 99340. Deletion of home or resident services E&M code 99343. Revision of home or resident services E&M codes 99341, 99342, 99344, 99345, 47 through 50 and guidelines. Deletion of prolonged services E&M codes 99354 through 99357. Revision of guidelines for prolonged services E&M codes 99358, 59, 99415, and 99416. Revision of prolonged services E&M code 99417 and guidelines, as well as establishment of prolonged services E&M code 993X0 and guidelines. That code hasn't come out yet. The E&M guidelines section has been revised and it details the classification of evaluation and management services. And it states The E&M section is divided into broad categories such as office visits, hospital inpatient or observation care visits, and consultations. Most of the categories are further divided into 2 or more subcategories of E&M services. For example, there are 2 subcategories of office visits, new patient and established patient. And there are 2 subcategories of hospital, inpatient, and observation care visits, initial and subsequent. The subcategories of E&M services are further classified into levels of E&M services that are identified by specific codes. The basic format of codes with levels of E&M services based on medical decision making or time is the same. First, a unique code number is listed. Second, the place and or type of service is specified, for example, office or other outpatient visit. Third, the content of the service is defined. And fourth, time is specified. A detailed discussion of time is provided in the guidelines for selecting level of service based on time. The place of service and service type are defined by the location where the face-to-face encounter with the patient and or family caregiver occurs. For example, service provided to a nursing facility resident brought to the office is reported with an office or other outpatient code. New and established patients, solely for the purposes of distinguishing between new and established patients, professional services are those face-to-face services rendered by physicians and other qualified healthcare professionals who may report evaluation and management services. A new patient is one who has not received any professional services from the physician or other qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice within the past 3 years. An established patient is one who has received professional services from the physician or other qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice within the past 3 years. There is a decision tree, so see the decision tree for new versus established patients. In the instance where a physician or other qualified healthcare professional is on call for or covering for another physician or other qualified healthcare professional, the patient encounter will be classified as if it would have been by the physician or other qualified healthcare professional who is not available. When advanced practice nurses and physician assistants working with physicians, they are considered as working in the exact same specialty and subspecialty as the physician. For more information on all of these changes, check out the link in the description box. So you have learned that both CMS and the AMA have put out information regarding the evaluation and management coding and guideline changes for 2023. And you have also learned the details. Questions of the day. Did you know that this information had been released? Do you think they will be helpful in evaluation and management coding? Let me know in the comments below. I would love to hear your thoughts or my final thoughts. As stated before, these evaluation and management services changes have been anticipated since the office and other outpatient evaluation and management services changes in 2021. I am glad we will get out of operating in both old guidelines and new guidelines, but remember, this will open up the doors for reviews and audits because we'll be in the same pool. For some reason though, I don't feel like we are being provided enough time to educate providers, especially those who may not have used the office and other outpatient E&M codes and may not be familiar with work or have working knowledge of the changes and expectations. We will know soon enough, huh? I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well, check out these videos and check this out. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, smashing the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you. So let me know you were here by providing a comment or question. You can also give me a little love by sharing this video on your social media platforms. And while you're at it, tag me in your video share at prncoding.edu. Let's stay connected and connect others. Well, you have stayed until the end, and let me know in the comments where you are checking in from. Also, let me know if you have any specific questions or items that you would like to see discussed right here on our channel. If you want to learn more about the wonderful world of health information, medical coding, and/or compliance, then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.